Welcome. Today we're discussing a specific heart condition, bicuspid aortic valve with aortopathy. This complex condition involves both a malformed aortic valve and abnormalities in the aorta itself. Understanding this condition is crucial for early detection and effective management. Let's explore the underlying causes. Bicuspid aortic valve or BAV is primarily a congenital defect, meaning it's present at birth. Instead of having 3 leaflets, the aortic valve only has 2. The cause of aortopathy, or disease of the aorta, in individuals with BAV is complex, but it's often attributed to genetic factors, altered blood flow patterns due to the abnormal valve, and inflammation within the aortic wall. Certain genetic syndromes can also predispose individuals to both BAV and aortopathy. Now, let's delve into the pathophysiology, or how this condition affects the body. A normal aortic valve ensures unidirectional blood flow from the heart's left ventricle into the aorta. A bicuspid valve often doesn't open or close properly. This can lead to aortic valve stenosis, where the valve doesn't open fully, restricting blood flow. Or, it can lead to aortic valve regurgitation, where the valve leaks, allowing blood to flow backwards into the left ventricle. These issues put extra strain on the heart. Furthermore, the abnormal blood flow associated with a BAV can weaken the aortic wall over time, leading to aortopathy. This weakening can manifest as aortic dilation, aneurysms, or even aortic dissection, a life-threatening tear in the aorta's wall. Epidemiologically speaking, bicuspid aortic valve is the most common congenital heart defect, affecting approximately 1 to 2% of the population. The prevalence of aortopathy in individuals with BAV is significant, with a substantial number developing aortic dilation throughout their lives. Men are more likely to be affected than women. The prevalence is higher within families where BAV is already present, underscoring the genetic component. The signs and symptoms of BAV with aortopathy can vary significantly. Some individuals may remain asymptomatic for many years, with the condition only being detected during routine medical examinations. However, as the condition progresses, symptoms may emerge. These can include shortness of breath, especially during exertion, chest pain or discomfort, fatigue, dizziness or lightheadedness, palpitations, or a feeling of rapid or irregular heartbeats, and a heart murmur, which can be heard with a stethoscope. In severe cases of aortic stenosis or regurgitation, heart failure can develop, leading to swelling in the legs and ankles. Diagnosis typically involves a combination of physical examination and diagnostic testing. A heart murmur detected during a physical exam may raise suspicion for BAV. An echocardiogram, which uses sound waves to create images of the heart, is crucial for visualizing the aortic valve and assessing its function, as well as measuring the size of the aorta. Other imaging techniques, such as cardiac MRI or CT scans, can provide more detailed information about the aorta and valve. Genetic testing may be considered in some cases, especially if there is a family history of BAV or aortopathy. While there aren't distinct classifications or types of BAV, it's important to note the different ways the 2 valve leaflets can be fused together. The degree of aortic stenosis or regurgitation can also vary. Aortopathy can manifest in several ways, including aortic root dilation, ascending aortic aneurysm or aortic coarctation. Treatment and management strategies depend on the severity of the valve dysfunction and the extent of the aortopathy. For mild cases, regular monitoring with echocardiograms may be sufficient. For more severe aortic stenosis or regurgitation, surgical valve replacement or repair may be necessary. If the aorta is significantly dilated, surgical repair, potentially involving replacement of the affected segment of the aorta, is often recommended to prevent dissection. Medications, such as beta blockers or AC inhibitors, may be prescribed to manage blood pressure and reduce stress on the heart and aorta. Lifestyle modifications, such as regular exercise and a heart-healthy diet, are also important. Unfortunately, there's no definitive way to prevent BAV itself, as it's a congenital condition. However, individuals with BAV can take steps to slow the progression of aortopathy. This includes maintaining healthy blood pressure, avoiding smoking, and adhering to a heart-healthy lifestyle. Early detection and regular monitoring are also crucial for managing the condition effectively. The prognosis for individuals with BAV and aortopathy can vary depending on the severity of the condition and the effectiveness of treatment. With appropriate management, many individuals can live long and healthy lives. However, without timely intervention, severe aortic stenosis, regurgitation, or aortic dissection can lead to serious complications, including heart failure and death. Recent research focuses on identifying genetic markers that may predict the progression of aortopathy in individuals with BAV. Advances in surgical techniques and transcatheter valve therapies are also improving outcomes for patients with this complex condition.